Welcome back. Back in May, UW Health and the WIAA collaborated on a study of the impact COVID-19 had on physical activity and mental health in high school athletes. The results were alarming. Physical activity dropped 50% due to the cancellation of a spring season. There was a 23% increase of symptoms of depression. In an extension of the study, UW Health recently released these findings on the incidence rates of COVID-19 from fall sports athletes in Wisconsin. In September, 207 schools participated in a study, about half the schools in the state. 30,000 student athletes were represented from 16,000 practices and 4,000 games. The study concluded that participation in sports is not associated with an increased risk of COVID-19 among high school student athletes. The case rates from those 30,000 were lower than the numbers reported by the Wisconsin Department of Health Services for 14 to 17-year-olds in that same time period. Dr. Drew Watson from UW Health led the study and joins me now. Dr. Watson, after looking at the results from the study, I noticed that all of the schools that were surveyed had a formal plan in place for risk reduction, correct?
Yeah, I think that's such an important point. I mean, what our data can suggest at this point is that the incidence rate among our athletes does not appear to be higher than the incidence rate among adolescents, while we have schools that are implementing a large number of risk reduction protocols. They're incorporating things like, symptom checks or symptom monitoring, temperature checks, facility disinfection, hand washing, mask use coming to and from the facility, staggering arrival and departure times to reduce congestion in parking lots. Those sorts of things, I think, are going to be impactful everywhere that they get applied. I can't speak to it directly from this study, but presumably if those were not in place, the risk would be considerably higher. And while I think that it's possible we may find different incidences as we move into the winter and we repeat this study, there really is, I don't think, any argument against continuing to implement the sort of practices that we saw them reporting in this study.
Here in southeastern Wisconsin, we're seeing a number of football programs that have been forced to postpone due to COVID-related issues. Do you feel like it is safe for these high school athletes to play right now?
I mean, I think what we can say from the data that we've collected over the last 6, 7, 8 months is that restriction from school and sports appears to have significant, physical and mental health impacts, and that at least within Wisconsin in the last, in the month of September, we didn't see that participation in athletics was associated with an increased risk of COVID-19. But it's also important to recognize that we're only measuring one narrow part of sport participation. We're really just talking about athletes. We also need to be focusing very seriously on reducing the risk of transmission of other people that are associated with sports, whether that's fans, referees, staff. I think if we are going to make the decision to move forward with respect to youth sports in a local area, we really need to be optimizing and really doing everything that we can to put in place the sort of procedures that would protect everyone associated with it.
How do you find that balance of the understanding that we don't know the long-term effects of COVID-19 at this point and the impact that can have with the short-term mental health problems that these athletes deal with?
Yeah, I think that is the challenge. We've only been able to insert a little bit of information into a conversation that needs a lot more. What I hope to be able to do is to provide some amount of information that families and organizations can use to make decisions about that balance of risk and benefit. But we've only been able to really address a couple of the specific elements that go into calculating whether this is the right choice. And my hope is that as we continue to add more and others add more, we incorporate all of that into the decisions that we make.
And what do you feel like is the biggest hurdle as we do move indoors for the winter sports season?
I think the biggest hurdle is that we're always kind of playing catch up, right? It's very hard to make decisions about sports until you have data about those sports. And on some level, we don't have any data until they start to be played. So I think the hardest part about this is we're talking about information about COVID in late October that was collected regarding September. So we're always kind of playing catch up. And I think that's the biggest challenge, is keeping up with something like COVID that changes so rapidly and decisions that are being made so quickly, using a process that on some level is always kind of looking backwards and trying to just keep up to provide information about the decisions that get made so quickly.
And what would be your advice for the students that decide to play and for the families that may watch this and wonder if it's safe to send their kids out onto the field or court, whatever it may be?
I think my advice would be to, one, tell people that it is very reasonable to be concerned about COVID-19 and nervous about it and wary of the possibility of catching it, and that we should be extremely supportive of people who offer that they're apprehensive about it and choose not to participate. I would also encourage people to do everything you can to make sure that you're safe while you're participating if you choose to do so. I think that we run the risk of trouble, particularly when we cut corners around the procedures that I think keep athletes relatively safe when they're participating. Encouraging people to utilize all of those risk reduction procedures is just a message that I hope comes through for everyone.